really important that a profession has representation, primarily to government in cases of taxation or healthcare policy, the insurance industry, because those are the ones that decide whether our claims are paid or not, the gatekeeper health disciplines who authorize our treatment plans, and of course the public media as well. And we also need representation to protect us from competitors or people that would exploit the value of massage. So the way to do that, of course, is you want to have really strong schools that are not only producing good students, but active students that are active in the profession. You also want a very strong professional association. I mentioned in my talk that at this point the professional association is under-supported, and it's as if we're trying to massage with just two fingers on our hand. We're limited that way. We really need to bolster up our professional association and help it do the work of representation that it needs to do. The naturopaths and the acupuncturists scored a real victory last year when they were able to become HST exempt. Now, the way they did that was they were able to get regulated in 5 provinces and to actively approach government and get themselves delisted from HST. HST is a huge obstacle in the massage therapy field. We're adding 13% onto services. It's money that therapists aren't putting into their pocket. And for small, arguably more fringe professions like naturopathy and acupuncture, for them to move ahead of us is really embarrassing. I mean, the RHP, the Regulated Health Professions Act, came into play in Ontario in 1991. And here we are almost 25 years later, a quarter of a century later, and we still only have 4 regulated provinces. We're just not doing enough collectively and not focusing enough on our common objectives collectively to move forward that would improve the viability of massage therapist practice and make us be seen in a better light with the government and the insurers and the gatekeeper health disciplines and the public and media. The most important thing we could do in the profession is bringing us all together to discuss through these issues, identifying common objectives, and we do have common objectives. I mean, we want to see more research, we want to see better public and media relations, we want to see better education and training, we want to see better relations with the insurers. So we have common objectives, it's just we need to have the conversation on our differences and then decide how to move forward. I think if we were trying to drag through the profession, well, I think we'd see just what we're seeing now, which not a lot of progress at all, where other professions like naturopathy and acupuncture recently just zooming past us.